Chairperson, because I just wanted to add that, to indicate that these outreaches that are referred to that we were leading are also to bring to effect the contribution of cancer to gender-based violence, especially the 4 cancers, which is prostate and testicular, cervical, and breast cancer. Because they are linked to the bedroom chair, you know, the jewels of the family, they are the big contributors to gender-based violence. So in these outreaches, it's an integrated government outreach, but we also do, as DSD, part of our prevention, to make sure that men and women are actually tested and they get free services, so that we make sure that they are able to get assistance. The last one is the sign language interpretation services. That I think it's very important that the committee is aware that.
You said 3 things, TM. I think you are getting stamina now.
That's the last one.
Okay.
That is important. Before you ask us, that the command center is disability friendly, even deaf, disabled women are actually accessing, even when they are deaf, they are accessing the command center services. We do have deaf employed social workers in that one. Thank you, Chair.
Thank you, Jam. Honorable members, I've got the following names in my chart: Honorable Ngwenya, Honorable Abrams, Honorable Van der Merwe, Honorable Aris, Honorable Manganye, Honorable Masango, Honorable Bilankulu, Honorable Mvana, Honorable Anastasia Mtaung. I'm going to stick to a 4 minutes principle. It's even a lot, because I'm looking at the time at our disposals. Can we start with Honorable Ngwenya?
Engos Kakulche, I will stick to the 4 minutes. Whatever is left, I will do it in writing. Firstly, thank you very much for the presentation. Mine is mainly on Pillar 4, which I feel that the DSD must make sure it is very important that they excel in this pillar and go above and beyond, and make sure that they bring change in the GBVF situation in this country. Firstly, I would like to ask, I've seen in the presentation, if we can get, I know that ADG touched on it slightly, but if we can get all the information on the CGE report, the report that the study that they conducted on the challenges that are faced by the shelters, that they need to be looked into. Secondly, I need to emphasize mostly on the GBV Command Center. I do commend them that they're looking into, they are disability friendly, which is very good. And I just want to stress and emphasize on the fact that it must not be just on receiving calls and collecting stats. We must be seen, the GBVCC must be seen to be very reactive and very responsive to the calls of these women, that we are able to come and say, the GBVCC, these are the calls we got, this was the response that we did, these are our referrals, and these are the follow-ups we made in terms of the GBV, so that we know that the GBVCC is making changes within the issue of of gender-based violence and femicide. I cannot stress enough, I've always stressed this in the meetings, Chairperson, we need centralized database. It is very important that in this country, we learn the skill of centralizing data, because that will assist us so much in dealing with so much things. DSD, health, police, education, if we can have a system that collects all the data and it is centralized for every department to be able to access that. Also, I would like to request the MECs of every provinces, if it is possible, Minister, that as it says on the report, on the presentation, that they are ambassadors of the GBF programs within their provinces. Therefore, it would be nice to have them now and again to come and tell us what is happening in their provinces, the strides that they are taking, and their proactive programs that they are doing within that. We note the challenges noted in the presentation of the NSP, and I think that we need to dwell on that so much and see what can be done at a later stage. So I will send those in writing to make sure that I give my 2 cents contribution on those, on how we can assist. And on pillar 4 as well, on pillar 3, I just need to find out. I heard that DSD made a contribution on the VSS bill. I would just like to find out that what was the contribution of the DSD on that bill, and I also want to know the contribution made by DSD on the amendments of Domestic Violence Act and Criminal Law on Sexual Offences Related Matters Act, and the timelines, if possible, on the policy on sheltering services and the policy of provision of psychosocial services. How are they going to do it? When do they think that we will have that policy in place and implemented? There is a lot, Chair, but I will stop there and I will send others in writing. Thank you, Chair.
Thank you, Honorable Abrams.
Thank you, Chairperson, and thank you to the department for the presentation. Chairperson, my questions or statements goes around what the Minister said earlier, and in that we'd like to see the impact of the work that we're doing on the ground. And in this portfolio committee, we speak a lot about asking how is the programs and interventions impacting and whether we can measure this. And I'm happy that the Deputy Minister gave us something in that 59,000 men are currently, who have accessed the WhatsApp line, are currently now in the DSD programs. So my question then is to go a step further and ask the department, can we not then get the information and the data on of the women who access the Command Council? How many of those women are then successfully removed from their violent situations? How many of those women are successfully placed in our DSD VP programs? How many of those women that come through the Command Council get placed in our shelters? You know, and once again, how many of the men are in the programs and in the family strengthening programs? Because it's very good and well to have these presentations where we discuss the policy frameworks and we discuss what services there are, but we need to start looking at the second part, which we never quite get, and that is the actual data on the impact that these programs are having. Because when we look at our annual crime stats, it almost feels that these programs aren't having any impact because the numbers keep getting higher. And if the numbers keep getting higher, then there's something amiss that we're not doing right. And then also, Chairperson, then maybe the question should be is, can the department provide the committee with a more comprehensive report on the data and the challenges and the successes, and not just because also before they would give us the total of the GBV calls, of the total calls coming through to the command center, but then they would also break it down and give us the numbers of what is not related to GBV and what is related to GBV. And then to go a step further, because since we are talking about the impact of alcohol on GBV, can we not get the stats and break it up a bit further in that what were the calls between the ban on the alcohol under the certain levels and when the ban was lifted, and then again when the ban was reintroduced, and now once again the ban is lifted, because it's only through the actual evidence and the data can we see real impact. So I just would like to know if we can get that information. And another stat that would be useful is how many of these women are repeat callers. You know, what is the stat on repeat callers of women calling into the Command Council? And then lastly, Chairperson, under Pillar 4, the slides speak about women accommodation beyond the shelter, and I just want to find out if beyond the shelter means a halfway houses, and if that's included in any way in the new Victim Support Services Act. Thank you, Chairperson.
Thank you, Honorable Abrams. Honorable van der Merwe.
Thank you very much, Honorable Chairperson. And yes, thank you very much to the department, the Minister, the Deputy Minister for the presentation. And I would like to agree with the Honorable Minister that this can definitely never be a political issue and that we must all unite to fight gender-based violence. I would like to start with the issue that I've raised before, Chairperson, and that is that there seems to be a problem, and I would like to get some thoughts on this from the Minister and the Deputy Minister about what is going on in the Eastern Cape. You would have seen, we spoke about Lisa Vetten in the introduction, but there seems to be quite a serious problem with regards to payments, with regards to the Eastern Cape and payments to their non-profit organizations, which affects not only, for example, women's shelters, but also old age homes. So I also know that there's been short payments to various organizations in other provinces like Limpopo, Mpumalanga, and the Northwest. But have you been able to establish what the problem is? Because the fact of the matter is we cannot have plans and programs, again, that aims to fight and deal with gender-based violence, but then when we need to refer women that are in desperate need for help to shelters, they find themselves on the doorstep of a shelter that's not received the funding that they need to be able to assist women and children in need. So I need to get an indication in that regard. The ADG did speak about shelters, the importance of shelters, and it did mention that shelters have been complaining about funding is not streamlined, or for example, in some instances, a shelter might be getting a stipend from government that's 10 Rand, while another shelter might be getting a 50 Rand. How long will it take for you to be able to streamline the stipends? So the policy timeframes, which the Honourable Ngwenya also spoke about. I would like to also emphasize on what the Honourable Ngwenya and Abrams have said in terms of the call center. I think we've made this plea on numerous occasions that when we speak, for example, about that 102,000 calls, SMSs, interactions that we've received to the call center over this lockdown period, at least there we need to see a breakdown in terms of calls received, how many of these were serious enough cases that they were, X amount of these calls were referred to shelters, X amount of these calls referred to somebody being treated in hospital, X amount were referred to the police for investigation, and X amount is, for example, in front of the court currently. Because I think when we look at a number like that, without having proper details and proper information in terms of the logical follow through, whether any of these people have really gotten the assistance, the help that they needed, that information will remain not too useful for us. Again, I would like to ask the CARA funding. I'm a bit confused because in our last meeting, I remember when President Ramaphosa announced this funding, I thought he promised 200 million. I was later corrected to say that he promised 50 million, but today the minister is speaking about 100 million that has been allocated to the NGOs. I need to also ask whether all of the NGOs have received their stipends and whether we can be given a list of NGOs that will be benefiting from this CARA funding. And just to link again to the issue of proper data, we spoke, about having proper information in terms of the logical follow through. But for example, in these pillars, we speak to the issue of not only sheltering women, but then giving them access to job opportunities and skills training. And I think as we progress in terms of this national strategic plan, at a later stage, when you come back as a department, you also need to report to us, for example, this woman was removed, went to a shelter, was taught a skill, and has been successfully rehabilitated, maybe in another community, or she's received a skill.
Your time is up, Honorable van der Merwe.
Okay, I'll wrap up.
You.
But if we can see that type of information going forward.
Honorable Aris, thank Honorable.
Yeah, thank you. Thank you, Chairperson. Good morning, Chairperson. Morning, Minister.
Good morning, Honorable Harris. Yes, good day.
Goeiemôre. Chairperson, victims of gender-based GBV experience high levels of post-traumatic stress. And I have noted in the presentation that they say they have a helpline that offered services. But what about those people that don't have access to technology, and is that the only services that we render to these people? And then, Chair, the shortage of shelters in this country is huge, but apart from that, there's a need for multi-sectoral post-GBV facilities, shelters, to work with survivors and victims, because when people get out of these shelters, there's no post GBV facilities for these people. And then in Pillar 4, Chairperson, with women, the program for August month I have noted is mostly digital. My question is, what about the people in the deep rural areas that don't have access to these technology TVs? I did see DSTV and all these things. What about that? What programs do we have for those, or how will we reach that people? Then I've also seen, I didn't hear that you said the Department of Public Works, because this GBV is not only a DSD program, but it is a multi-departmental program. Because apart from that, the Department of Public Works have the facilities, as we said, to the shortage of shelters. They have the facilities where we can, work with them to get access to their buildings to bring up more shelters, because that's a big problem in the country. Then in terms of the educational plans, I did hear they say the Department of Higher Education are also on board, but yes, we need the Department of Basic Education also, because educational programs, we need to get this in schools, and it must start from a primary level, that where we start to educate our learners on the importance of GBV and self-respect and respect to others. And then, Chairperson, we must not only talk about GBV, we must give it a name. We must come up with a slogan for that. I have written an article in Palestine. They have this thing, they call it "My Body is My Property," where all women are wearing bracelets that said my body is my property, to create that awareness, that women need to wear these bracelets. And then in terms of programs, we need to come up with programs like Honorable Liesel van der Merwe was saying. We need to come up with programs where we must empower this woman, that the women stop being dependent on their partners, because then that's where they become the victims of these gender-based violence. And then also, Chair, in terms of, I didn't hear that you say that we also have the Department of Labor. Apart from physical abuse,
for the first time, Honorable Harris, for the first time, you speak beyond your time. It's unusual.
Sorry, just this last one. In terms of the workplace, because women are also suffering mental abuse from their co-workers, their employees, and that's also things that I would say that we address. Thank you. Sorry about that.
Thank you very much, Chair. I must also thank the department for this presentation. I just want to ask or make a comment. I was happy when I hear Linton and Kolile mention the shelters. My recommendation is that, about the shelters, is that maybe sometimes when NPO or NGO applies, before it can be given a